and I will give the floor to Georgi in order to listen, to hear more about the artificial intelligence put together with the thermography as a method. What can show? Thank you.
Thank you very much for the introduction. Thank you very much, Professor Petrov, for the great presentation and introduction to thermography. So let me open the presentation that I'm going to show you today. So essentially old but with new methods, that's a very good quote. I'm going to be talking about how thermography coupled with AI can essentially be created to save millions of lives today. My name is Georgi Kostadinov. I'm co-founder and CTO of Kelvin Health, and I'll be happy to present you in the next 15 minutes about this topic. So this is the scope of the presentation, starting with introduction to what we do, our mission, our team, which is currently the whole team in this room for the first time in, I don't know, several months, I believe, because Chris is living in South Korea. Then I'm going to cover an introduction to the pandemic called the PAD pandemic. Then I'm going to cover the thermography AI solution, how thermography is coupled with AI essentially, a demonstration of this solution, its value and benefits to the clinical care, and I'm going to end this presentation with some references and real-world examples from our practice. So starting off with our mission. Essentially, our mission is to make preventable deaths and suffering from PAD and COI, I think in the past, by coupling thermography, AI, medical science into one discipline, essentially, into creating one single product that can early detect all kinds of different anomalies and vascular changes that can be prevented. And by doing this, I mean, this is the team behind all of this idea. We have assembled a great team of medical experts, great medical experts, AI experts, business experts, and we have all the necessary tools and expertise to pull this off. In terms of AI expertise, I can say that we are in the field since 2012. We have developed hundreds, even thousands of algorithms for extracting all kinds of visual information, visual concepts from images, from videos. And we extract such information to create value to our customers that essentially creates a positive value to their end users. So let's talk about the PAD pandemic. I'm sure that most of you know how large scale this condition, this medical condition is, but still let me put some numbers on the table. First of all, there are over 200 million people worldwide that are affected by this disease. And due to the fact that it's really hard to diagnose in the early stages of the disease, most of them actually, the condition worsens and to the point of having COI, which affects 22 million people each year. And out of these, 60 to 70% are having at some point in time amputation, unfortunately. For diabetes, patients with diabetes, this number, there is 7 times more likely a chance to have an amputation, which is quite unfortunate. In terms of the healthcare system, as we know, there is high patient demand, but there's lack of specialists worldwide. And moreover, and most importantly, there's a lack of reliable, rapid, and precise and non-invasive methods that can easily detect PAD and give insights to the specialist to understand what should be the next step for treating this patient. And based on these two factors, there's a very low throughput of diagnosing PAD, which leads to very late intervention and very late treatment of such patients. And with Kelvin, we are trying to solve all these challenges, all these problems, by combining thermography, by combining medical science and the artificial intelligence, of course. So we're using a 4-1 Pro model, the mobile thermal camera, and we're coupling it with the mobile phone currently to take 5 photos of the legs from different angles, and then analyze these photos using artificial intelligence, proprietary artificial intelligence algorithm that essentially, after the analysis, it tells the specialist what is the actual condition based on thermodynamics of the patient. We have created for this purpose a data collection platform that is for the review of all the data that has been collected using the mobile phone and this camera. And using this platform, the specialists can gain additional insights on the data that they have collected. And moreover, it's of course encrypted, secure, based on all of the HIPAA and GDPR compliance regulation frameworks. And at some point in the future, once we have developed all of the AI algorithms, they will provide the insights as part of this platform. The mobile application, the unique thing about it is that we have created a proprietary segmentation algorithm that essentially is able to segment very, in a contrast and clear way, the problem, the issues within the vascular system. So for this, we have created algorithm, thermal segmentation algorithm, and specialists, while using the application and while using this algorithm, have told us that it's much clearer for them to see where the problem is in the vascular system than using, for example, standard Fluor 1 Pro applications. And the next slide is all about the AI and how the AI analysis works. Of course, our words don't allow us to share more details here. But essentially, the way that we do it is by combining all of the 5 angles into a single spatial temporal space and analyzing them to gain insights of what is the actual condition of the patient at the moment. The way that the AI technology works is by training it on a large-scale database that we are currently collecting with partners in the field. And this large-scale database, essentially the way that's being learned from it is by extracting what is the most common pattern among them that correlates to this specific pathology of PAT and CLI. So essentially we are creating a statistical model, and once the model is done, complete, then when new data comes in and is being analyzed, it essentially tries to see whether this new data fits within the model, and if it doesn't fit, what is the actual discrepancy that has been detected. So what is the difference that it has been detected? Essentially what we do, as seen from the slide, is we segment all the angiosomes of the legs, as you can see, and for each angiosome we provide a risk assessment, risk score, whether or not it's PAD or CLI is visible. But why does it work? Actually, Professor Petrov covered that briefly. Essentially, there are 4 main reasons why thermography works, and coupled especially with AI algorithms. The first one is information from viral infections where local body temperature is increased. The second one is metabolism, where we have very local increase of blood flow, oxygen, and thus temperature. The third and the fourth, spasm and blockage, are related to lower amount of blood flow in local regions, and especially the fourth one is directly correlated to PAT and CLI, which essentially mean that there is some kind of a blockage or stenosis within this local region. And here's an example of how this actually looks like. So as you can see from the image, at the knee level there's I believe thrombosis. Dr. Stankovic may share more details about that later on. But essentially, this directly correlates, the thermal image directly correlates with the actual diagnosis done via angiography, because from the angiography images you can see that just right at this knee level there is lower blood flow. So some demonstration that I'm going to show you how the actual method is used within clinical practice. As you can see, the specialist takes 5 photos of the legs from different angles. Then these photos are sent for analysis, and the platform using the AI algorithm suggests essentially for each angiosome what is the risk assessment. And as you can see, the angiosomes have been detected, and for each angiosome has suggested scoring based on a scoring system that we've created with the team of Professor Petrov and Dr. Stankov. This scoring system suggests whether there is stenosis or thrombosis within this particular angiosome. And what is the value and the benefits of having such a device within the clinical practice? So first of all, we sit right in the middle, right after the patient visit and right before the actual angiography and intervention. What we are able to do is to optimize the whole process of initial diagnosis by essentially providing a very fast approach for triage that is able to very easily and accurately give insights to the specialist whether or not the patient should go for angiography or whether or not the patient should go home, essentially. And all of that eliminates all of the unnecessary costs involved with angiography and with the diagnosis of PAD that we have calculated is up to 38% for HCPs around the world. This method as well also is very fast, as mentioned. It's 15 to 36 times faster, which can lead to much faster diagnosis by the specialist. And of course, last but not least, it provides real-time monitoring during the intervention as part of the catheterization labs, which is something that is not seen elsewhere with other devices currently. And some references. Currently, we have collected over 2,000 thermal images from 300 patients. And based on these images and data, we have preliminary results of 97.7 specificity. Of course, this is preliminary. We are currently in the process of validating that with more patients, with more data. This data will also be valuable for training the algorithms, for creating the final product, and of course for medically certifying the whole solution. Some examples, but Dr. Sank will cover them in a much medically great detail. So currently you can see that there's an aortic blockage here for this patient, and it's directly correlated with the thermal image. Ischemia on the fingers is also quite easily visible, as you can see. That's a hand with ischemia, and you can see how the fingers are out of the range of the thermal palette. And after the vascularization, everything has normalized in the fingers. Pre-stroke in bowel detection, you can see the differences, the cold spot on the left side, and after that, the stenting, how everything went back to normal. Some other use cases that I wanted to mention. Breast cancer is one of our other use cases that we are currently working with Novartis Oncology to essentially identify and to see what is the scope of the technology there. Rheumatoid arthritis, it's really important to have early detection of such disease there. In traumatology, such a solution can be used to localize the trauma and to be much easily diagnosed when, especially the patient is unconscious. And for COVID-19 monitoring, this was actually one of our first use cases that we essentially evaluated, and we saw that there is a direct correlation with viral infection and with what's shown on the thermal camera. So as you can see, there are quite a high variety of use cases that thermal cameras can be applied, and especially thermal cameras coupled with AI. So we believe that if we join forces and together we can help prevent the suffering and the effects that such conditions such as PAD, breast cancer, any type of conditions can have on patients worldwide. Thank you very much for your attention.